Tonight in Medical Rounds, a major technological breakthrough when it comes to pacemakers. Imagine a pacemaker that is compatible with a mobile app. Doctors at Hartford Hospital are one of the first in the country to use the world's only pacemaker that can communicate directly with patients' smartphones and tablets. Joining us live now to tell us more about this exciting new technology is Dr. Zweibel, Director of Cardiac Electrophysiology at the Hartford HealthCare Heart and Vascular Institute. Good evening, Dr. Zweibel. Nice to see you again.
Good evening, Denise. Thanks for having me.
This sounds fascinating. You have to tell us, how does this technology work?
Well, Denise, we're really excited about this here at Hartford. We're actually one of the few centers in the country that is using this technology and studying how people use this Bluetooth technology and apps on their phone. Historically, what we've done is provided patients with a monitor that they plug in at their bedside. This monitor speaks to their pacemaker and communicates back to us to let us know that everything is going okay with their device. New pacemakers that we're implanting now have Bluetooth chips in them, and they actually can speak to a patient's iPhone with special software on it, an app. This then communicates back to us in a quicker fashion, and we're hoping provides with more reliable follow-up for these patients. The exciting part to me is that this is an app, and so it's software that can be upgraded. So I can envision in the future that the pacemaker might be able to notify a loved one or a healthcare provider if the patient falls, for example.
All right, that is a great point. The question, though, is in this day and age of hacks and cybersecurity, of course, is very paramount in people's minds. How secure is the transfer of patient data?
Well, clearly the companies are worried about this as well, and it's incredibly secure. The data is encrypted in the pacemaker before it's sent to the phone, and then it's encrypted again in the phone before it's sent out to the servers where we can see it. And it's critically important to know that the patient's pacemaker works perfectly fine without the patient's iPhone, so if they lose it, their pacemaker functions normally, and you can't reprogram a patient's pacemaker with their phone, so it's completely safe.
Okay, we have time for one last quick question. Maybe you can give us a quick answer. How long does this pacemaker last?
Well, normally I tell my patients that their pacemakers would last 7 to 10 years, but with this new technology and improvement in battery and circuitry technology, now I can tell my patients safely that they're going to have about 12 to 14 years out of their device, which is going to lead to less operations to replace their pacemakers.
That is good news. Well, we thank you so much, Dr. Zweibel, for sharing this innovative technology with our viewers. Now, you at home, if this sounds like it could be something that you'd like or want to learn more about, call the number you see on the screen. In the meantime, Dr. Zweibel will be answering your questions on the Hartford Hospital Facebook page. We invite you to join the live discussion happening right now.